Hello friends. Here are 100 bilingual multiple choice questions focusing on nutritional deficiency diseases. Let's start. 1. Night blindness is caused by the deficiency of which vitamin? Correct option: A. Vitamin A. 2. Which disease is caused by a severe deficiency of vitamin C? Correct option: B. Scurvy. 3. Beriberi is a neurological and cardiovascular disorder caused by the lack of which nutrient? Correct option B. Thiamine vitamin B1. 4. Pellagra, characterized by dermatitis, diarrhea and dementia, is caused by a deficiency of? Correct option D. Vitamin B3 niacin. 5. Megaloblastic anemia can result from a deficiency of which vitamin vital for DNA synthesis? Correct option: A. Vitamin B9 folic acid. 6. Chylosis, marked by painful cracks at the corners of the mouth, is linked to a lack of? Correct option: B. Vitamin B2 riboflavin. 7. Pernicious anemia occurs when the body cannot properly absorb which vitamin due to a lack of intrinsic factor? Correct option: C. Vitamin B12. 8. Burning foot syndrome is traditionally associated with deficiency of thinch B-complex vitamin. Correct option: A. Pantothenic acid vitamin B5. 9. Deficiency of vitamin B6 pyridoxine can directly lead to which neurological manifestation? Correct option: A. Peripheral neuropathy. 10. A deficiency of which vitamin during early pregnancy can cause neural tube defects like spina bifida in newborns? Correct option: B. Vitamin B9 folate. 11. Alopecia, hair loss, and scaly dermatitis can be caused by a rare deficiency of a? Correct option: D. Biotin vitamin B7. 12. Xerophthalmia, which progresses from night blindness to dry cornea and eventual blindness, is caused by a lack of? Correct option: B. Vitamin A. 13. Beto's spots, which are triangular foamy spots on the conjunctiva, indicate a deficiency of? Correct option: C. Vitamin A. 14. Bleeding gums, loose teeth, and petechiae are classic signs of a deficiency in? Correct option: C. Vitamin C. 15. Glossitis, an inflammation of the tongue making it look smooth and beefy red, is most commonly caused by a lack of? Correct option: A. Vitamin complex. Trigger rapid epithelial atrophy. 16. Infantile beriberi occurs in breastfed infants whose mothers suffer from a deficiency? Correct option B. Thiamine. 17. A deficiency of vitamin B12 is unique because it causes macrocytic anemia accompanied by what other clinical feature? Correct option: A. Neurological degeneration. Tantrika tantriki kshati. 18. Scurvy causes poor wound healing primarily because vitamin C is a necessary cofactor for which structural process? Correct option: D. Collagen hydroxylation. 19. Which vitamin deficiency can mimic the symptoms of mechanical bowel obstruction or peripheral vascular disease through severe muscle cramping? Correct option: A. Thiamine. 20. Prolonged absence of which nutrient causes localized hyperkeratosis around hair follicles, phrenoderma? Correct option: A. Vitamin A. 21. Rickets is a childhood disease characterized by soft, weak bones caused by a deficiency of? Correct option: C. Vitamin D. 22. Osteomalacia is the adult equivalent of rickets and is caused by the deficiency of? Correct option: A. Calcium or vitamin D. 23. Defective blood clotting and increased bleeding tendencies are caused by a deficiency of? Correct option: C. Vitamin K. 24. Hemolytic anemia in premature infants can be triggered by a deficiency of which antioxidant vitamin? Correct option: A. Vitamin E. 25. Hemorrhagic disease of the newborn is prevented globally by giving prophylactic injections or. Correct option D. Vitamin K. 26. Neurological problems like ataxia, loss of vibration sense, and muscle weakness can result from chronic deficiency of. Correct option A. Vitamin E. 27. Bowlegs and knock knees in growing children are structural bone signs of. Correct option B. Rickets. 28. Osteoporosis, a condition of reduced bone density and brittle bones in the elderly, is exacerbated by long-term deficiency of. Correct option A. Calcium or vitamin D. 29. Craniotabes, which is the softening of the skull bones in infants, is an early sign of. Correct option D. Rickets. 30. Frequent bruising, epistaxis, nosebleeds, and hematuria without trauma suggest a lack of. Correct option A. Vitamin K. 31. Rachitic rosary, a visible enlargement of the costochondral junctions, is a pathological finding in. Correct option A. Rickets. 32. Deficiency of vitamin D causes secondary hyperparathyroidism because. Correct option A. कम कैल्शियम पैराथायराइड हार्मोन की रिहाई को उत्तेजित करता है. 33. Harrison's groove, a horizontal deformity along the lower border of the thorax, is associated with. Correct option C. Severe rickets. 34. Pigeon chest, pectus carinatum, develops in children suffering from advanced stages of. Correct option A. Vitamin D की कमी. 35. Anticoagulant drugs like warfarin work by inducing a functional deficiency of which vitamin? Correct option D. Vitamin K. 36. An adult patient presents with deep bone pain, proximal muscle weakness, and a waddling gait. They most likely have. Correct option A. Osteomalacia. 37. Dietary deficiency of vitamin E is extremely rare but it occurs secondary to which type of medical condition? Correct option A. Fat malabsorption disorders, वसा अवशोषण के विकार जैसे सीलिएक या cystic fibrosis. 38. Tetany, characterized by involuntary carpopedal spasms and hyperreflexia, can be a neurological sequela of. Correct option D. Vitamin D और कैल्शियम की कमी. 39. Hypoprothrombemia is a medical term directly signifying a deficiency or dysfunction related to. Correct option A. Vitamin K. 40. Malformed or delayed eruption of permanent teeth in a young child can often trace back to an early childhood deficiency of. Correct option D. Vitamin D or calcium. 41. Iron deficiency anemia is characterized by red blood cells that are A. Correct option A. Microcytic or hypochromic. 42. Goiter, an abnormal enlargement of the thyroid gland, is caused by a chronic deficiency of. Correct option C. Iodine. 43. Severe iodine deficiency during pregnancy can lead to what congenital condition in the child? Correct option A. Tinism Jarvamanta. 44. Microcytic anemia primarily causes fatigue and shortness of breath because. Correct option A. रक्त की ऑक्सीजन ले जाने की क्षमता कम हो जाती है. 45. Spoon-shaped nails koilonychia is a unique physical diagnostic sign of severe. Correct option D. Iron deficiency, iron की कमी. 46. Hypocalcemia can produce a positive Tvostek sign which is demonstrated by. Correct option A. Tapping the facial nerve to elicit muscle twitching. चेहरे की तंत्रिका को थपथ पाकर मांसपेशियों में ऐंठन पैदा करना. 47. A positive Trousseau's sign indicative of latent tetany from low calcium or magnesium is triggered by. Correct option A. Inflating a blood pressure cuff above systolic pressure. Blood pressure cuff को systolic दबाव से ऊपर फुलाकर. 48. Pica, a craving to eat non-food substances like dirt, ice or clay, is strongly linked to. Correct option A. Iron deficiency, iron की कमी. 49. Chronic magnesium deficiency, hypomagnesemia, often coexists with and complicates the treatment of which mineral imbalance? Correct option A. Hypokalemia cum potassium. 50. Endemic goiter refers to a high prevalence of thyroid enlargement within specific geographic regions due to. Correct option C. Low iodine content in local soil and water. स्थानीय मिट्टी और पानी में आयोडीन की कम मात्रा. 51. Plummer-Vinson syndrome includes iron deficiency anemia, glossitis, and which esophageal complication? Correct option A. Esophageal webs causing dysphagia. Esophageal webs जिसके कारण निगलने में कठिनाई dysphagia होती है. 52. Hypomagnesemia can directly cause cardiac arrhythmias, notably which characteristic ECG pattern? Correct option A. Torsades de points. 53. Severe chronic iron deficiency alters behavior in children primarily by affecting the metabolism. Correct option D. Brain neurotransmitters like dopamine. मस्तिष्क न्यूरोट्रांसमीटर जैसे कि डोपामाइन. 54. Osteopenia describes a condition where. Correct option A. Bone mineral density is lower than normal, but not yet osteoporosis. अस्थि खनिज घनत्व सामान्य से कम होता है, लेकिन अभी तक ऑस्टियोपोरोसिस नहीं हुआ है. 55. Prolonged deficiency of dietary calcium over decades forces the parathyroid glands into a state of. Correct option A. Chronic hyperplasia ग्रंथि का स्थायी विस्तार. 56. Serum ferritin testing is highly valued in diagnosing anemia because it measures. Correct option C. Total cellular iron stores. कुल कोशिकीय आयरन का संचय stores. 57. Myxedema madness is a term used to describe psychiatric symptoms arising from profound adult deficiency of. Correct option A. Thyroid hormone iodine की कमी. 58. Restless legs syndrome RLS can often be managed or improved by correcting an underlying deficiency of. Correct option C. Iron. 59. The muscle weakness seen in magnesium deficiency results from the mineral's physiological role in. Correct option A. Adenosine triphosphate, AT स्थिरीकरण और enzyme सक्रियण. 60. Angular stomatitis and koilonychia occurring simultaneously in a patient strongly points toward a diagnosis of. Correct option A. Severe iron deficiency anemia. गंभीर आयरन की कमी से होने वाला एनीमिया. 61. Acrodermatitis enteropathica is a rare genetic disorder leading to a severe malabsorption and deficiency of. Correct option D. Jingjasta. 62. Dental caries, tooth decay, occur much more frequently in populations whose drinking water lacks. Correct option A. Chloride. 63. Kashan disease, a potentially fatal cardiomyopathy seen in parts of China, is caused by a deficiency of. Correct option A. Selenium. 64. Menkes kinky hair syndrome is an X-linked recessive disorder that results in a severe deficiency of A. Correct option C. Copper tamba. 65. Impaired wound healing, loss of taste, agesia, and delayed sexual maturation in adolescence are linked to. Correct option A. Zinc deficiency, zinc की कमी. 66. Kashinbeg disease, characterized by severe osteoarthropathy and deformed joints, involves a deficiency of. Correct option B. Selenium. 67. Deficiency of chromium in the human body can mimic symptoms of which metabolic disease? Correct option A. Madhumeh, diabetes mellitus. 68. Microcytic anemia that is completely unresponsive to iron supplementation can sometimes be caused by a deficiency. Correct option D. Copper. 69. Neutropenia, low white blood cell count along with skeletal abnormalities in infants can indicate a deficiency. Correct option A. Copper. 70. Hypojusia, a reduced ability to taste food, occurs in zinc deficiency because zinc is a structural cofactor for. Correct option A. gustin carbonic anhydrase. 6. 71. Severe zinc deficiency can lead to an acquired immune deficiency because zinc is critical for. Correct option C. T lymphocyte development and thymic hormone function. T lymphocyte vikas or thymic hormone karya. 72. The hypochromic microcytic anemia found in copper deficiency occurs because of a secondary impairment in. Correct option A. Systemic iron transport and usage. Pranaligat iron parivahan or upyog. 73. Mottled enamel, while a sign of fluoride toxicity, fluorosis demonstrates that a precise balance of fluoride is needed to avoid. Correct option D. Tooth structure vulnerability and decay. दांतों की संरचना की संवेदनशीलता और क्षय. 74. Total parenteral nutrition, TPN, solutions lacking trace minerals over long periods can induce a deficiency of. Correct option A. Chromium, copper or zinc. 75. White muscle disease in livestock, structurally related to Kashan disease in humans, is managed by supplementing soil with. Correct option D. Selenium. 76. Disrupted collagen cross-linking leading to aortic aneurysms in animal models, a copper deficiency occurs due to failure of. Correct option A. Lysine oxidase. 77. An infant showing poor growth, neurological decline, and strikingly brittle, twisted hair white in color most likely has a genetic defect in. Correct option A. Copper absorption, Menkes disease, copper अवशोषण Menkes रोग. 78. Chromium deficiency alters glucose tolerance parameters primarily by modifying. Correct option B. Cellular sensitivity to circulating insulin. परिसंचारी इंसुलिन के प्रति कोशिकीय संवेदनशीलता. 79. Night blindness that does not resolve with heavy vitamin A therapy can sometimes indicate a coexisting deficiency. Correct option A. Zinc. 80. Microcytic hypochromic anemia accompanied by prominent skin and hair depigmentation is standardly evaluated for. Correct option D. Copper deficiency, copper की कमी. 81. Kwashiorkor is a form of malnutrition primarily caused by a severe deficiency of a. Correct option A. Protein with adequate calorie intake. पर्याप्त कैलोरी सेवन के साथ प्रोटीन की कमी. 82. Marasmus is a severe form of protein energy malnutrition characterized by a deficiency of. Correct option D. Both total calories and prone. कुल कैलोरी और प्रोटीन दोनों. 83. The prominent abdominal swelling, pitted edema, seen in children with kwashiorkor is caused by. Correct option B. Decreased plasma oncotic pressure, due to low serum albumin. कम सीरम एल्ब्यूमिन के कारण प्लाज्मा ऑनकोटिक दबाव में कमी. 84. Flaky paint dermatitis, where skin scales and peels off leaving raw wounds, is a hallmark sign of. Correct option C. Kwashiorkor. 85. A child presenting with an old man face or monkey face due to extreme loss of subcutaneous facial fat is suffering from. Correct option A. Marasmus. 86. The flag sign in kwashiorkor refers to. Correct option C. Alternating bands of light and dark color in hair. बालों में हल्के और गहरे रंग की बारी-बारी से पट्टियां दिखना. 87. Fatty liver, steatosis, occurs in kwashiorkor but not in marasmus because. Correct option A. Lack of apolipoproteins prevents lipid export from liver. एपोलिपोप्रोटीन की कमी लीवर से लिपिड निर्यात को रोकती है. 88. Muscle wasting in marasmus is a physiological adaptation designed to. Correct option B. Provide amino acids for gluconeogenesis to keep the brain alive. मस्तिष्क को जीवित रखने के लिए ग्लूकोनियोजेनेसिस हेतु अमीनो एसिड प्रदान करना. 89. Why are children with severe protein energy malnutrition highly susceptible to frequent severe infections? Correct option A. Atrophy or the thymus and impaired immune cell synthesis. थाइमस का शोष एट्रोफी और प्रतिरक्षा कोशिकाओं के संश्लेषण में रुकावट. 90. Cachexia is a profound wasting syndrome most commonly seen secondary to which chronic conditions. Correct option C. advanced cancer, HIV AIDS, and end-stage organ failure. उन्नत कैंसर, HIV एड्स और अंतिम चरण के अंग विफलता. 91. Sarcopenia specifically describes the loss of muscle mass, quality and function associated with. Correct option A. Aging and chronic physical inactivity. बुढ़ापा और पुरानी शारीरिक निष्क्रियता. 92. During the initial treatment or severe marasmus, introduced calories must be strictly controlled to prevent. Correct option A. Refeeding syndrome, refeeding syndrome. 93. Refeeding syndrome causes life-threatening complications primarily due to a sudden severe drop in serum levels. Correct option D. Phosphorus. 94. Bradycardia and hypothermia are common in children with advanced marasmus because. Correct option A. The body slows metabolic rates to conserve minimal energy reserves. शरीर न्यूनतम ऊर्जा भंडार को बचाने के लिए चयापचय दर को धीमा कर देता है. 95. Anorexia nervosa can lead to a severe psychiatric induced form of. Correct option A. Calorie marasmus. 96. The bradycardia observed in severe starvation states drops the heart rate to lower work demands, directly causing a reduction in. Correct option B. Cardiac output, हृदय की कार्य क्षमता. 97. Essential fatty acid deficiency can occur in patients on long-term fat-free TPN, presenting clinically as. Correct option A. Dry scaly dermatitis and poor wound healing. सूखी पपड़ीदार त्वचा शोथ और घाव भरने में रुकावट. 98. Edema in quasio can mask the true extent of a child's. Correct option C. Muscle wasting and weight loss. मांसपेशियों की बर्बादी और वजन घटाने की वास्तविक सीमा. 99. The crazy paving skin pattern seen in protein deficiency states describes. Correct option A. Hyperpigmented plaques that crack open along natural skin fissuries. Hyperpigmented plaque जो त्वचा की प्राकृतिक दरारों के साथ पट जाते हैं. 100. Complete absence of dietary protein blocks the production of which crucial digestive enzymes in the pancreas. Correct option A. Trypsin, chymotrypsin or lipase. Thanks for watching.